Now, luteal phase ovarian stimulations are changing the way fertility treatments are done. In the past, we believed that you have to stimulate on day one of the cycle, or you would start thinking of giving a pre-treatment with either progesterone for a few days or estrogen. And those seem to be getting challenged. Traditionally, we mean a follicular phase start. So you start from the first day of the period or after you've given downregulation or after you've given, let's say, estrogen or progesterone. This is because the body naturally begins to grow eggs. The luteal phase comes after ovulation. It's once assumed that starting stimulation would give less eggs or might change the chance of having a healthy baby. But repeated research, including the last recent research, shows that worries are not something we should be really worried about. In real world, they looked at hundreds of women with ovarian stimulations in the follicular phase and in the luteal phase and saw how many mature eggs were collected, how many of these embryos were genetically normal, and how many live births happened after frozen transfers. They found no meaningful difference between two approaches. The clinical pregnancy rates were almost the same, between 67 to 68%, and the chances of live birth did not drop with a luteal phase start. Embryogenetic health and quality remained on par, showing change in hormonal environment does not hurt results. This opens multiple possibilities, and I'll tell you why. Many a time, you can only stimulate ovaries depending on their follicle count. So if you see 5 or 6 follicles, you're not going to get 8 eggs. Consider the attrition rate. Sometimes you see a better follicle count in the luteal phase, which means when you scan in the luteal phase, you can start. So to some extent, you can predict and tell someone what is the maximum number of eggs you can get. Equally, you can tell someone in the follicular phase that you do not have many follicles left and it is not the right time to start. And like this study is quite reassuring, though it is retrospective. More research will give us much better idea, but the general idea now is that, in fact, you can stimulate whenever you want. The risk remains always of an ongoing pregnancy in the luteal phase, but oocyte quality does not diminish. I go a step further often to say, stimulate whenever the follicle count is the best. That will give you the best chance of getting more eggs and may help to get more embryos.